Today I'm excited to dive into why it's crucial for pediatric therapists to understand and apply the 5 core measures of early childhood development within their pediatric setting. These measures embedded within a coaching model of treatment are not some sort of arbitrary concepts that I've just kind of conjured up on my own. Rather, these are integral components of 2 coaching models of treatment. 1, the universal developmental care model of treatment, and 2, the neonatal integrative model of treatment, both of which are backed by several studies. Now, as we go along, I want you to envision yourself as this specialized coach, influencing and applying each of the core measures to help support what we call the parent-infant dyad, thereby laying this robust foundation to help support the infant and child's developmental progress. So let's dive in. The 5 core measures are protected sleep, pain and stress management, healing environment, family-centered care, and ADLs. The parent and infant are in the center. This is what is known as the parent-infant dyad, and the core measures are encircling the parent and infant. Now, therapists, us as providers, we are out here. Our role as that specialized coach is to help push and influence the parent-infant dyad with each of the core measures. This is to help promote development and that successful parent-infant interaction and positive participation. Now, protected sleep is considered the most important core measure because of all the processing, building, and repair that our bodies and brains are going through due to the exposures throughout our day. With pain and stress management, this is looking at the level of ease and positive engagement the infant or child is experiencing within their natural environment. Now, I want you to ask yourself a few questions. What happens to me when I'm under stress? Does everything seem to be more difficult? Yes. Do I seem to not feel good and have low energy? Yes. When I'm under a lot of pain and stress, do I sleep very well? No, of course not. So all of these negative effects that we can have as adults when we are under increased pain and stress, our little ones will also have the same negative effects. Now, we have all heard the expression, you're a product of your environment, right? So when looking at the components of the healing environment, it takes into account all those like tiny little tweaks that we can do to help again support the parent-infant dyad with whatever activity is most important to them. So ask yourself, have you ever had difficulty concentrating because of sounds or temperatures of a room? Well, of course you have. And we can be surrounded by tiny little distractions that when combined can prevent any of us from achieving optimal performance. Again, the same thing holds true for our little one. Now, moving along, let's look at ADLs, okay? These are the activities that are developmentally appropriate for that infant or child, depending on their development or age. This could be bathing, dressing, feeding, diapering, etc. And with family-centered care, we are customizing our treatment according to what is most important to that family. We are providing that specialized coaching to promote that parent-infant dyad, which will in turn help to promote the child's development. Think of it this way. When your household is not functioning well, are you able to focus on any type of additional tasks? Well, of course not. So when we start with these core measures, we are giving our families that base of support they need to be able to focus on other therapeutic activities. Okay, now let's take a look at the following 3 courses that can help you with each of the core measures, which ultimately will help support the parent-infant dyad and the child's development. Now, let's take a look at 3 ways that you can get started with learning the coaching model of treatment. Number 1, the Certified Infant Massage Coach. The Certified Infant Massage Coach course will teach you massage strokes from the top of the head to the tips of the toes. But it's not just learning the massage strokes. We also learn the science behind them. when to use them, what strokes are best for various diagnoses that we would see on our caseloads, how to document, how to write goals, how to bill for service. And I like to offer lots of self-reflection. Again, how many of us as adults still and go get a massage? A lot of us, right? And why is it that we typically go and get a massage? Well, usually we go and get a massage because we've been under so much pain and stress that it's now affecting our ability to sleep and function well throughout the day. The same thing holds true for our little ones. And you may be asking yourself, well, what type of stress do infants even go under? Well, let's think about it. How many times have parents on our caseloads tell us, my infant is so fussy with diaper changes, or hates bath time, or cries after a feeding? A lot, right? Well, then it's no wonder that so many infants and children on our caseloads have trouble sleeping because of all the pain and stress that they are under. And we all know that if that infant or child is not sleeping, then the parent is not sleeping. And as a result, there is a breakdown in the parent-infant dyad. Megan, a developmental specialist from Maryland, sent me the sweetest email and said, I honestly have to say that infant massage is one of, if not my most favorite part of my job. Thanks, Megan. Let's move on to number 2, the Chaos to Calm course. So in the Chaos to Calm, it is specifically looking at the core measure of healing environment. And within this core measure, the literature specifically looks at the following: touch, light, sound, smell and taste, and temperature. After you learn how each of those components are developed, we then go into problem solving of what it could be within that infant or child's natural environment that is impacting their ability to positively participate in bathing, dressing, feeding, play, and sleep. Now within this course, I include what is done in the NICU and the transition home. I do this for 2 reasons. Number 1, I've had so many parents over the years tell me, for example, gosh, Miss Laura, when little Johnny was in the NICU, he did so well, and now that he's at home, he seems to be super fussy. Well, I typically start with the environment. I coach the parents that, the NICU was all that little Johnny knew, but not to worry that we can make a few little minor modifications to help him adjust to life at home. The number 2 reason, the American Academy of Pediatrics is now recommending infants born at 35 weeks in stable condition be discharged home versus going into the NICU for observation. So ask yourselves, if you work in outpatient or early intervention, how much do you feel like you are getting consulted on younger and younger infants? Best practice is expanding your knowledge of what are the techniques that would be done in the NICU, or what was done in the NICU, that could be explaining the infant or child's reaction to things within their now natural environment. Sarah, an early intervention staff supervisor and developmental specialist in Pittsburgh, PA, wrote, I thoroughly enjoyed this course and will be implementing the knowledge I have gained into my work with children and families. I would highly recommend this course to anyone working with infants. Thanks, Sarah. Do you see how the Certified Infant Massage Coach course and the Chaos to Calm course are impacting all of the core measures with the ultimate goal of promoting the parent-infant dyad? Now, step 3, the 5 core measures of early childhood development is, of course, all-encompassing of the core measures. It is broken into techniques both for the infant and during the toddler years. Each module will include evidence behind each of the core measures, such as why sleep is so important. Then the module will go into how to coach parents on promoting sleep, and I take it a step further and provide custom handouts and video demonstrations that you get to keep and utilize within your treatment sessions. Jessica, a physical therapist from Maryland, recently took the course and said, I am thoroughly enjoying this course so far. The information is fantastic and incredibly useful. Same with all the handouts. I keep trying to take as many notes as possible as I watch the videos because there is so much great information that is so relevant and I don't want to miss any of it. Thanks, Jess. Hopefully now you see how all 3 of these play such a huge role with how and why we coach our families. I get it. I'm still a treating therapist, and it can be overwhelming with trying to prioritize and address all of the parent-infant needs. However, when you utilize the core measures as your guide and you focus on pain and stress management so everyone gets good sleep, when you look at the components of a healing environment to promote positive participation in ADLs, and when you embrace the family-centered care concept, the results are amazing. So go ahead and sign up for either the Chaos to Calm or the 5 Core Measures course. You can sign up and begin those courses immediately. Then in the meantime, pick a date to attend the Certified Infant Massage Coach course. I do limit enrollment so I can best meet your needs. See you there.